The Eastern Cape has become one of the focus areas of the National Health Department's COVID-19 preventative strategy, with high fatality figures in the province's epicenter state as efforts are being ramped up to curb the spread of the virus. Earlier, Provincial Premier Oscar Mabuyane gave an update on the COVID-19 containment and mitigation plan.
A recommendation of the
President Cyril Ramaphosa recently announced that all Eastern Cape beaches would be closed from December the 16th to January the 3rd as a precautionary measure to contain the spread of the coronavirus. The province, which has been declared a hotspot, will rope in additional resources to the region in an effort to contain the spread.
No swimming, because the problem of swimming, people don't have masks. So we are looking at all those big gatherings where people will not comply with non-pharmaceutical protocols.
The region has received a much-needed boost in the fight against the pandemic. More than 1.2 million rand worth of PPE packs have been donated for distribution across the province.
Your congestion at your casualty and in processing patients to wards. In the wards there, we do have decanted beds, the COVID-19 beds that we have set aside for our patients. And they are not fully occupied. We still have spaces. That's why we have been encouraging people in Nelson Mandela that those with comorbidities must admit themselves in our field hospital, Volkswagen, Dr. Field Hospital.
Migrant workers and people on the move have been identified as the main carriers of the new variant of the virus. The Eastern Cape has a large workforce based in Gauteng and the Western Cape, and there are fears that their return home might push the numbers up.
We have to make sure that we protect more lives as our people are coming back home. We don't want those people to come and infect the families in rural areas, as we are busy trying to protect those families in rural areas. But we've encouraged our people that whoever comes away in your family, you must allow your own kind of a self-quarantine as you arrive home. Take some days looking at yourself so that you don't say that no, I don't have a COVID-19, only to find that when you left Western Cape, you didn't have it, but you got it along the way. But wearing those masks, even if you wear them for 14 hours, they help to mitigate and minimize any chances of people who would understand that even if it's 70%.
Premier Mabuyane has called for citizens not to be complacent despite a decrease in COVID-19 cases in the Nelson Mandela Bay area and Sarah Baartman District Municipality. The two areas, especially after the virus mutated and a new strain being fingered as the force behind the second wave. For Newzroom Africa on Channel 405, I'm Khotso.
All right, Khotso, thank you tonight. We stay in the Eastern Cape. Dr. Tobilen Mengaja, who is the special advisor to the Premier, joins us now to tell us more about the province's COVID-19 response plan to the second wave. Dr. Mengaja, good evening, and thank you for your time on News at Prime.
Good evening to you and your listeners and viewers. Thank you.
When we were talking the Eastern Cape 3 weeks ago, it was accounting for 50% of the infections in the country and was rising. How are things sitting now?
Yeah, no, thank you. It's true. At the time, the second wave really started in the Eastern Cape, and it was really driven by Sarah Baartman and the Nelson Mandela. Our numbers have really gone down now. We are probably about the fourth largest numbers of new cases at about 17% of the total numbers of the national numbers of new cases. And what's very important to us is that in Nelson Mandela, we've had about 43% reduction in the number of new cases. In Sarah Baartman, we have a similar reduction of similar number in Sarah Baartman. And we are also looking at the BCM. That's Buffalo City, Amatole, and Chris Hani. Those are growing much slower. The overall growth of the epidemic in the province has really stabilized, and we're starting to see a decline in many areas. But of course, we're very worried in the next 2 weeks to the 3 weeks, because this is the urgent part where we're going to have a lot of people coming in.
Talked about the people who are testing positive. Talk to us then about people being admitted and people who have lost their lives.
I think this is very important. I think there's been a major concern about our capacities to provide care to the people of the Eastern Cape. You'll recall that when we started in the first wave, we were very aware that this is going to be a much more difficult situation for us. So we made a lot of investments. What's important that we put about 3,707 COVID-specific beds, and we added oxygen in many of these beds. We expanded our capacities for critical care. We have now 540 beds for these. Most of those beds are still available for our patients. What we're experiencing in the province is that patients are actually flocking within the private sector. And this is overrunning and creating a huge stress in the private sector. The second issue is that in the November month, especially in November month and early December month, we had the highest number of people that were being admitted, about 209 per day. And that number has actually decreased now to about 126, about 40% decrease in the numbers. So we are seeing some very positive results of the interventions that the Premier has actually implemented since October.
Yeah. The biggest fear and worry and concern, I suppose, when you speak the Eastern Cape is that there are people who are losing their lives at home without means of reaching a hospital because of the various challenges that we have been dealing with, particularly with ambulances being able to reach some of the remote areas of the Eastern Cape. How are you monitoring that people are not just suffering in silence at home with COVID-19 without any means of getting to a hospital?
No, this is very true. We have actually followed the Medical Research Council, what is called excess death, and we've really been looking at that in terms of the number of people that are reported dead and the number of people that actually could actually be recorded from the national stats. We have actually understood, and we're starting to do what we called a post-mortem test of patients who are COVID positive, who have actually died. The second big area has been that we're really trying to impress on people that you can't manage COVID at home. And there's really a very unique system in the COVID that you can be losing oxygen and yet not knowing about it. So early admission is very important. The second one is that we're starting to find that more elderly people are being affected, and that with a lot of comorbidities, that raises the death. So we have about 6,000 deaths, but our death is about 3.8 per 100,000, which is still higher than what we would have expected. But I think we're still within the broader normal things. We expect that in the next 2 weeks, we're going to find the number of people who actually were sick, and they will actually be dying in the next 3 weeks. And our numbers could probably be stable as they are, and they might actually grow up a little bit longer, higher.
One of the toughest criticisms coming from the South African Medical Association of South Africa about the health systems or the health services in the Eastern Cape, they said there is a lack of leadership, particularly around the issue of getting funding for more doctors and nurses who are quite in short supply. Has this matter been addressed?
This matter has been resolved, and I think what is also very important, when Premier was actually making his statement during the day, he made it very clear. If the Medical Association has got doctors that are unemployed, I think I can stand here as part of the Premier's team to say that those doctors will find a space in the province. Secondly, we've actually made sure that all post-community doctors now, we are actually asking them to stay, and we'll provide them with the opportunity to work in the Eastern Cape. What we are finding is that because COVID has affected both the general population and the medical population, so the number of people that are becoming available for services are getting less and less, and obviously many people are being kind of fatigued. So we're really saying that this is not an Eastern Cape problem, it's a national problem. So we anticipate that all our partners will provide support, and we're really open to admit, and we go out of the country and look for places like Cuba to get more additional doctors, because we are not finding the doctors who are ready to serve in the rural areas.
The differentiated approach, or what you call localized lockdown restrictions, would you say they're bearing fruit, and are they staying put for now?
This is actually very important. We're at level 1. The way the epidemic works is actually driven by the science It is driven by what is called surveillance. It is also driven by the social structure of the communities. It's driven by the behavior. And we really, when we do with the risk adjustment, we're looking very closely on the number of deaths. We're also looking very closely in the capacity of our hospitals. We're looking very closely in the number of new cases. And all these create a matrix where you understand what decision you need to make. And the province has really been very upfront this time. We started as early in October, and we can see, the Nelson Mandela areas was the highest hit. And there has been a drop of about 40% of new cases, and that's really part of the intervention. What works is a mask. What works is a social distancing. What works is a hand hygiene. What works is not to have big crowds. And what works is to make sure that when you are really not feeling well, you must go to hospital early. We think those measures, when they are actually done at sufficient level and they are taken by many people, will keep us in a level 1 lockdown. That will make us to be able to continue with the economy and provide a much more less restrictive social life for many of the people in the Eastern Cape.
Dr. Tobilen Mengaja, I appreciate your time. Thank you very much for joining us, Special Advisor to the Premier of the Eastern Cape.